Professor Looy, welcome to Greece once again, I would like to ask you to fill us in on any updates on the important role of the dietitians, what the dietitians can do, how they can make a difference in the European ground arena, professional arena, how they can make a difference, whether it's because of governmental support or individual efforts or efforts by their individual associations. The role of the field of dietetics, how it can make a difference.
Thank you. Thank you for asking me these questions about the difference that dietitians can make. First of all, let me just define what a dietitian is and what a dietitian does. A dietitian is a qualified and registered professional, health professional, who has a 3 or 4 year degree course to enable them to give safe and competent advice and recommendations about health, food and nutrition. There are specialities of dietitians, if you will. So some dietitians work in a clinical environment in a hospital or perhaps in a health clinic. Some dietitians work in food service and food management, and that could be in a restaurant or in a hospital or in a large corporation. And some dietitians work in public health, advising on policy, developing educational strategies, and delivering nutritional programs, for example, in breastfeeding or feeding the under 5s. So there is a huge diversity of work fields that dietitians go into. Here in Greece, for example, we have some really good examples of initiatives being held in different parts of Greece with dietitians counselling people on better nutrition, better health, counselling families, working in schools, or in fact they might actually put on public health campaigns reaching larger audiences. Dietitians always work multi-professionally, so we work with doctors and nurses and midwives, we work with physiotherapists, we work with social workers, we work with caterers, the food industry and so forth. So we're not alone, because if you're really going to make a difference to people's health and their food and nutrition, you need a multidisciplinary, interdisciplinary approach. We don't work completely on our own, but we're qualified to do so. So that is really what a dietitian does in Europe. And by Europe, I'm talking about 29 countries of Europe. And I'm pleased to say that there are dietitians in at least 27 of those. Liechtenstein has the smallest number, but then of course it is the smallest country. I think there are 4 dietitians in Liechtenstein. But nevertheless, we do have a dietetic service there, and quite right too. EFAD represents some 32,000 dietitians in Europe, which is about half the number of dietitians. Now, there are not enough of us, because if you think the population of Europe is some 60 million, then 60,000 dietitians isn't really very many. And that's another reason for us working professionally, interprofessionally, so that in fact we can get others to give good, healthful nutrition messages. The other thing that dietitians are increasingly being recognised for is their cost effectiveness. So when you see a dietitian and you can reduce your weight, your hypertension usually then is reduced as well, your diabetes comes under control, and that actually saves on you going into hospital or making an appointment with a doctor or perhaps taking medication. And when you can stop taking medication because your disease is now under better control, dietary control, when you can stop taking medication because your weight and your hypertension are reducing, then that is saving money for the health system and saving you money as well. And dietitians are able to demonstrate their cost effectiveness by encouraging people to adopt more healthy eating strategies. We here have had the most fantastic conference. We have a conference every year. This is our 8th year, and every year they get better, and this year has been no exception, and we are just so delighted to have been to Athens and to have enjoyed the Hellenic hospitality, but also to have brought good nutritional scientists from other parts of Europe to help dietitians, to engage with dietitians, to speak to dietitians about the science and the research and the evidence. We also have dietitians, of course, that are doing research, and they've also been able to speak to us. And that, combined with our professional topics through our specialist networks, has enabled us to share those experiences of reaching difficult-to-reach groups. The vulnerable group, such as the older person, is a difficult group to reach if we're talking about prevention, because the older person perhaps doesn't travel very easily, doesn't go out very much. So how do we get the message through to them? And this is where we need the network of health professionals, and we need the network of families working together as well. So vulnerable groups is a difficult one, but we are working, and our specialist networks are sharing their successes as to how to actually approach the vulnerable groups and be more successful.